episode 10 of Clinc. I'm your host Danelle, registered pharmacist and lead practitioner at Clinic 1 Medical Aesthetics.
And I'm Alex, co-host and marketing specialist at Clinic 1.
Today's episode is going to be all about sclerotherapy.
Can you explain the difference between spider veins and varicose veins and how sclerotherapy addresses each condition?
So spider veins are these smaller veins that are much closer to the surface of the skin. Typically they're not very painful and they might appear as either red or purplish in colour, whereas varicose veins are often a lot larger and they sit a lot deeper in the skin. They tend to be a really dark blue or dark purple or red colour, and they can tend to be a little bit achy and sometimes a little bit painful as well. Now, sclerotherapy can address both of these issues, but it can only be used to treat smaller varicose veins. Larger ones are not able to be treated with a sclerosant in clinic.
So what type of sclerosant solution do you use and how do you determine the dosage for each patient?
So the sclerosant that I use in my clinic is a solution known as sodium tetradecyl sulfate. Now there is varying concentrations of this solution, but in my clinic I use the 0.2%, which is often the lowest concentration that'll treat the vein effectively. Sometimes we might need to use a solution with a concentration of about 0.5%. It all depends on the severity of the veins that we're treating.
What are the potential risks and side effects associated with sclerotherapy?
So some of the risks include bruising, swelling and skin discoloration at the site of injection. Some of the more severe side effects include things like allergic reactions, blood clots and inflammation, but these side effects are quite rare and with proper management these side effects can be minimised.
So how soon can patients expect to see results after undergoing sclerotherapy?
So most patients can expect to see results after just a few weeks of undergoing treatment. Now, sometimes repeat treatments are necessary, and often this is the case for much larger veins.
Are there any post-treatment guidelines or recommendations that a patient should follow?
So patients should avoid strenuous activity, prolonged standing or sitting down, and exposure to sunlight. Now, this is very, very important to prevent any discoloration to the area that's been treated. We also recommend that patients wear compression garments or stockings to help reduce inflammation, improve circulation and aid in the whole healing process.
What factors might affect the success of sclerotherapy treatment?
So factors that might influence success are things like the size of the vessel, its location and how the patient reacts to the treatment overall. And post-treatment care is really, really important as well in ensuring that we get the optimal results.
Are there any contraindications or circumstances where sclerotherapy may not be suitable for a patient?
So sclerotherapy is contraindicated in women who are pregnant or breastfeeding. It's also contraindicated in people who have a history of stroke or DVT, as well as patients who are diabetic. So those are instances where you would really want to avoid treating somebody.
How long do results of sclerotherapy typically last, and are repeat treatments necessary?
So results last a really long time, but unfortunately, there may be the development of new blood vessels. So further down the line, if these do appear, these may need to be retreated to address the concern again.
Can sclerotherapy be combined with other treatments for optimal results?
Yeah, so sclerotherapy could be combined with laser treatment or radio frequency ablation to provide optimal results. There may be the option to use something like polynucleotides or skin boosters as well to try and thicken the skin in the area to try and reduce the appearance of the veins.
What advice do you have for patients considering sclerotherapy for the first time?
So as always, it's really important to research the practitioner and book yourself in for a consultation with them to really discuss the treatment options and see whether the veins that you have are actually able to be treated in clinic or whether it's something that you might need to go and have a surgical intervention for. It's also really important to follow pre and post-treatment advice just to ensure that you're optimizing those results as much as possible. If you'd like to put yourself in for a consultation for a sclerotherapy treatment or find out more about the different treatments that we offer, you can hit the link in the description which will take you to our link tree where you can contact us to book your consultation, or you can download our treatment guide directly to your device.
Don't forget to like and subscribe if you enjoyed today's show. Hit the bell if you're watching on YouTube to get notified when our next episode is out, and leave a comment if you have anything interesting to say. Thank you for watching.